Dr. Paul, if you were a politician, I would have asked you this question because you seem to be shifting the onus onto the states. If you were a politician, I would have asked you a political question कि सब सेंटर की तरफ देख रहे हैं, आप कह रहे हैं कि ट्रांसपेरेंसी स्टेट का जिम्मा है, आप कह रहे हैं अवेलेबिलिटी ऑफ बेड्स, प्रेपरेशन, all that is states, healthcare facilities, states. I want to ask you at the central level, when people's confidence gets shaken, and let's take the example of the Delta Plus variant. Now, you in a statement had clearly said that the Delta Plus variant is a virus of interest. The health ministry comes in, calls it a virus of concern, then it calls it a variant of interest, then it goes back, calls it a variant of concern, comes back and says variant of interest. There is a flip-flop, 4 flip-flops in the space of 60 to 90 minutes. And that's when people begin to wonder that are we dealing with the scientific kind of transparency? Are we dealing with the situation where we are getting the real picture? Do, our scientific researchers or the bureaucracy in the health ministry, are they giving us the real picture? What is it that we are dealing with? And it is here that transparency is so very important. Today, I want to know from you, is this a variant of interest or is it a variance of concern? Is the Delta Plus growing at the rate that we saw the second wave? Is it going to impact children? These are issues common people are interested in, and when there are flip-flops in the health ministry itself, it definitely does not add to the confidence level of the people of India.
Now, Vikaji, I'll answer the 2 parts of the question that you raised. I want to come back to this issue of shifting responsibility that you mentioned, and I want to take it upon myself to respond. Remember, to address a pandemic-size colossal challenge, it is everybody's responsibility. Union government, state government, district administration, people at large, all stakeholders. It is a combined effort. It's a whole of nation, whole of society, and whole of government effort. There should not be doubts about it. When I gave you a couple of examples as to the availability of services, or for that matter, surveillance activities, would you please not appreciate the fact that this is implemented at the cutting edge in a district in J&K, in a district in rural Orissa, and in a district in Maharashtra, and so on. We must appreciate that the SOPs and approach to control pandemic, getting people along, preparing, it's a collective job. Union government has a profound and overarching responsibility to set the standards, to indicate which way to go, provide resources, help resources, take everybody along, and so on and so forth, and make technologies available, commodities available, oxygen available, and so on and so forth. So please, it is a shared responsibility. I went to a few examples to say that yes, when we are looking at transparency, it is a transparency at all the levels, including the union government, including a person like me who is playing a certain role. Yes, we should be transparent. And we are committed to that. I assure you that this is always to be taken as a shared responsibility. And when situation went the way it went, it was sad. It was sad, yes. We felt accountable to this. No question. I felt accountable. Certainly, because in spite of the best efforts, sincerest effort, sleepless nights, working, thinking through this new challenge about which everything is really not known, unpredictable enemy, invisible enemy. Yes, but then we have to face it and move on to do better and better. Now, in regard to the variant that you talked about, Navika ji, Delta variant, originally detected in Maharashtra, is clearly, now we know, rode this wave, pushed this wave. Just before this happened in April, Jan, Feb, around that time, it was the Alpha variant, particularly in Delhi and Punjab region. In this region, this is where it came and made a home. That part of the wave, earlier part, we may say, was the Alpha variant, the 117, the 117 variant. The Delta variant came in rather quickly because of its transmissibility, probably originated somewhere, we don't know where, but first detected in Maharashtra, as you know, and then it pushed the pandemic curve very, very ferociously, no doubt about it. And we now know today that it is highly transmissible. It is more transmissible than the Alpha variant found in UK, even higher than that. And UK had to face their second wave in the face of the Alpha variant, which is in a way, in retrospect, less transmissible than the Delta. So Delta is now a problem, not only in this country, but at least in 80 other countries. In some countries, it is making producing a significant challenge. Having said that, on Delta Plus. Now, Delta Plus, on the problem of Delta and the change that this has brought about in the virus, there is an additional change related to the spike part. The spike is the part which gets connected to the human cells. If there are changes there and it makes this connect with human cell more easy, more ready, more intense, that's a risky business. So the change that it has brought about is also the change that was seen in the Beta variant, which is the one that was found first in Africa. And therefore, it is of concern that could this be the reason for its future transmissibility or adverse effect. As of now, what do we understand? As of now, we know the following, that we have detected about 40 odd cases through our genomic surveillance system. These are spread in about 10 states. Delta Plus has also been found in some other countries. Today, it is not possible for us to say that Delta Plus variant is a variant associated with increased transmissibility. We do not know. Is it associated with neutralizing the effect of the vaccines? The answer is we do not know. Is it associated with higher severe disease, incidence of severe disease or death? The answer is we do not know. What we also know a little bit is that it tends to neutralize the effect of monoclonal antibodies from a study that has been done in some other country. In other words, please give science a little more time. We only have 40 such strains in the entire country today. So now the connections have to be made with clinical data, epidemiological data, and therefore this is a variant of interest, variant of investigation. As yet, it will not be proper to call it a variant of concern, which moves to an entity category where we believe that that variant and those variants are associated with increased transmissibility or worsening of the disease or changing the vaccine susceptibility or diagnostic paradigm.